Welcome to our keynote speaker session 3. It's our pleasure to have Dr. Kelly Morrison with us today in this session. Dr. Morrison is our Minnesota House Representative for District 33B. She graduated from Yale University and then received medical degree from Case Western Reserve University School of Medicine. At that time, she was awarded the Alice Page Cleveland Prize. She then completed a residency program in obstetric and gynecology at the McCaw Medical Center and Prentice Women's Hospital, where she also served as a chief resident. She's been practicing obstetrics and gynecology at the Women's Health Consultant since 2001. She has been a Minnesota State Representative since 2019. During the last 2 years as a Minnesota House Representative, she was awarded the Children's Health Hero Award, awarded to legislators who stand up um, and advocate for our children. This was awarded by Children's Minnesota and the MMA's James Sova Memorial Award for Advocacy. Dr. Morrison is married. She has 3 children. She's passionate about her family, travel, and the BWCA. Dr. Morrison will talk to us about reflections of a physician in politics from bedside to Minnesota House Representatives. Dr. Morrison.
Well, thank you so much for that very kind introduction. It's a tremendous honor to be with you. I'm quite humbled to be participating in a conference that features so many esteemed guests, physicians, and scientists. My talk today will likely be different than most of you hear this weekend. I will not reveal any new breakthroughs or share an important study. I'm a practicing OBGYN and recently a state legislator. And I'd like to share a little bit about my journey from being a practicing physician to serving in an elected office, and perhaps even sneak in a call to get you to consider running for office. Whether we like it or not, whether we think of ourselves as political or not, people in elected office, from the presidency to state legislatures, make policy that impacts every aspect of our lives. From our roads to our schools, to the air we breathe and the water we drink, to the taxes we pay, to how we practice medicine, care for patients, and how and whether we are able to conduct scientific research. So, a little bit about me. I have deep roots in Minnesota. I'm actually a sixth generation Minnesotan and have been practicing in Minneapolis for almost 19 years. But I've lived in other places. I lived in New Jersey and Mexico City as a kid, and my education and training took me to New Haven and Boston and Cleveland and Chicago. So I have the perspective to appreciate what a special place Minnesota can be. And we have a proud tradition of medical excellence with the University of Minnesota and obviously the Mayo Clinic. I've been with the same practice since I finished my residency in 2001, and I've loved being a doctor. I practice with some of the best people I know, and I'm grateful for them and my patients every day. My husband and I have 3 wonderful and challenging kids who have kept us on our toes from day one, and we juggle career and family with mixed success, like most of us. My career has been in women's health, which unfortunately is often politicized, and I've served on the board of Planned Parenthood. So there are ways in which I feel like I've always been involved in politics, but never in an official capacity. I'm a little bit of a political junkie. I've followed statewide and national politics since I was a child, but hadn't really followed local races. I did have a growing sense of unease about the erosion in public trust in science and expertise, and was concerned about the state of political discourse in our country, but I can't say that I really knew what to do about it. Then the 2016 presidential election happened. The campaign was disheartening to say the least, and I was frankly pretty unhappy about the outcome. I had to do something. So I started to get more involved at the local level and learned more about who was representing my district at the State House. And I was disappointed to learn that the 3-term incumbent was a person who promoted anti vaccine views and policy and who regularly spread anti science conspiracy theories, among other unsavory positions. So one thing led to another, and with the blessing of my family and my partners, I was running for office. The theme of my campaign was for a healthy, thriving Minnesota, and the values of improving access to healthcare, protecting our water and natural resources, and addressing climate change, supporting excellent public education and gun violence prevention, as well as being a voice for science and evidence-based policy, animated my campaign. If we believe in the concept of a citizen legislature where people from different backgrounds with different skill sets come together to make policy, it's important that we have people with science backgrounds, arguably now more than ever, as the complexity of our challenges increase. It's critical that we have people who have practiced medicine at the decision making table when policy is being debated and made. I live in the definition of a purple district, which I see as an opportunity because we increasingly live in silos in the United States. In my district, Republicans and Democrats and independents live next door to each other. Their kids go to school together, they play sports together, they worship together, and they're friends. These kinds of interactions among people of differing views is critical if we are to find our way through these polarized times. I believe we have to find a way forward together because, of course, we have much more in common than we don't. Physicians know this well from interacting with and taking care of our patients. So I approached the campaign like a community building exercise. I had a great group of volunteers and interns, and together we door knocked the district almost 4 times, held many town halls and community gatherings, sent thousands of handwritten postcards, and one conversation at a time, we broke through and won the election by 216 votes with 83% voter turnout. The values of my campaign informed my work at the legislature, and I served as vice chair of the Health and Human Services Policy Division, and I was on the Environment and Natural Resources Committee, the Water Committee, and the Early Childhood Education Committee. I think you'll agree that it's important to have physicians' voices in health policy conversations. Aside from our clinical and scientific expertise, I believe we bring skill sets to politics that we need more of. We're listeners by profession, and we clearly need more of that. We're also accustomed to working with and caring for people from different backgrounds and perspectives and creating treatment plans in partnership with them. These are skills that are desperately needed in these hyper-partisan times when we must be forward-looking, working to create a new future together. We went into medicine fundamentally because we wanted to help people, and I see government service as an extension of that ethic. When I entered the legislature in 2019, we faced many challenges, but the world has changed dramatically in 2020, and we now face what I see as 5 crises simultaneously: a global pandemic, the economic fallout of that pandemic, racial injustice and social unrest, direct and real threats to our democracy, and the climate crisis. Each of these have subcategories, and of course, we could spend hours discussing each. All are complex, and we must confront them simultaneously. We're living in unprecedented times. We can become focused on what happens at the federal level, especially in times like these. And we do need competent leadership at the top, but there are ways in which what happens at the state level impacts the daily lives of Minnesotans perhaps even more. Minnesota has been a leader in many areas: healthcare, education, and business, to name a few. But we also lead in areas that we shouldn't. We have some of the worst racial disparities in the entire nation, in many of the same areas in which we are seen as leaders: education, housing, income and wealth, and healthcare outcomes. We've known that racial injustice exists, and we've known that disparities between white and Black Minnesotans in many areas have been unacceptably large. We've known that the Black experience with police is much more deadly than the white experience, but we frankly have been spinning our wheels on making changes. But the killing of George Floyd in our own backyard this year provoked an intense local reaction, which quickly led to national and then international protests. The video of his killing has served as an apparent wake-up call to many. The generational disparities that exist in education, housing, employment, and of course in healthcare access and outcomes have been both laid bare and exacerbated by the COVID pandemic. The combination of George Floyd's death and its aftermath and the global pandemic has created a new urgency and perhaps an unprecedented willingness to actually face up to and address these issues. The national and international reaction to this tragedy seems to have galvanized a multi-generational rainbow of support for systemic change. In spite of our many challenges, there is hope in this moment of pain and tragedy for real change. Our interconnectedness has never been more apparent. None of us is an island. Truly, we all do better when we all do better. So, with all of that as background, I believe healthcare policy, especially, must be seen through a public health and equity lens. And I'd like to share some of my experiences and policy efforts as a state legislator. A particularly egregious example of the health disparities that exist in Minnesota relates to my specialty of obstetrics and gynecology. Black and American Indian women are 3 to 4 times more likely to die during pregnancy or in the postpartum period than their white counterparts. And this is true when controlling for education and income. So while we know that being a person of color in Minnesota increases your risk of being low income and low wealth, there's more going on here than poverty. Like many complex challenges, there is no one fix or silver bullet. But one way we can help is to be sure that women are eligible for care for a year postpartum. Women on Medicaid or medical assistance in Minnesota during their pregnancy are only eligible for 60 days coverage postpartum. I introduced a bill that would ensure that women on medical assistance have health insurance for a year postpartum. Ensuring that women have access to care during one of the most vulnerable periods in their lives is critical. There's great appetite in the Minnesota House and within the Department of Health and DHS for this change, but we were unable to generate enthusiasm for it in the current Senate. Another area of opportunity is to exempt providers of prenatal care from being mandatory reporters of women who use substances during their pregnancies. When we think about the opioid epidemic and the disease of addiction, the last thing we want to do is discourage pregnant women who use substances from seeking the care they need during their pregnancies. We want people to view their providers as trusted collaborators rather than adversaries on an opposing team. The sooner women get care and treatment, the better the outcome for them and their babies. My colleague and friend, Representative Ruth Richardson, authored the recent House resolution declaring racism a public health crisis in Minnesota. She is also passionate about ending health disparities, and we've teamed up on several bills aimed at addressing them, including the Dignity in Pregnancy and Childbirth Act. The bill aims to address and reduce disparities in maternal mortality. It calls for adding severe morbidity to maternal death studies that the Commissioner of Health may study in order to better understand the systems that lead to preventable deaths. Severe morbidity is described as anyone who is admitted to the ICU during their pregnancy or postpartum, or anyone who received a blood transfusion of 4 or more units. The intention is to catch the near misses in order to better understand what is going on with our disparities. The bill also calls for requiring annual continuing medical education for the 2 most common preventable causes of maternal death in obstetrics: postpartum hemorrhage and maternal hypertensive disorders, as well as implicit bias training and creating a plan to integrate how implicit bias impacts the treatment of postpartum hemorrhage and maternal hypertension. Our public health challenges are legion. Continuing to work to decrease youth tobacco and vaping are critical, and the passage of the Tobacco 21 bill into law this past year was important, making it illegal to sell tobacco and tobacco-related products to anyone under the age of 21. We know that the risk of long-term use and addiction are higher the younger people start to use and can lead directly to the attendant health risks of long-term use. Preventing firearm injury and death is another important public health priority. We have a gun problem in America. Far too many are injured or killed by guns. Physicians ask their patients about gun ownership, proper storage, and access because we have known for a long time that the presence of a gun in the home increases the risk of injury, death, and suicide. In the Minnesota House, we did pass what most consider to be common sense gun violence prevention measures: universal criminal background checks and extreme risk protection orders. The Senate unfortunately did not take it up, so those measures are still not law in Minnesota. Particularly in the age of COVID-19, it's unfortunate to see increased suspicion in the public about immunizations. The medical, scientific, and public health communities are going to have to think creatively about how best to educate patients and the public about the safety and success of vaccines. Many of us are pinning our hopes for returning to some kind of normalcy on the development of a vaccine against the coronavirus. But if people won't accept a vaccine, it obviously will not be effective. The state legislature will likely need to be involved in this impending public health issue by providing funding for a public health campaign. In these uncertain times, I worked hard to reach across the aisle. In the context of the only divided legislature in the country, I did have some legislative successes, and I'm proud that 80% of my healthcare bills had bipartisan authors. Republican Senator Julie Rosen and I collaborated on a bill to allow kids to apply sunscreen in school without a doctor's note. Yes, this needed to be legislated. This was a little non controversial, feel good bill championed by some dermatologists that had no opposition. But Senator Rosen and I got to know each other while working on it and forged a relationship that would serve us well when we took on thornier issues together. One was the Drug Price Transparency Act. The price of prescription drugs has skyrocketed to a point where many people are simply unable to afford the drugs they need to thrive, and in some cases, to survive. All of us will need a medication at some point in our lives. Many of us need a prescription every day. We are all aware that the price of prescription drugs has accelerated in a way that has put life saving medications out of reach for some Minnesotans. As a physician, I see this in my practice every day. The tragic story of Alex Smith, the young man with insulin dependent diabetes who died because he rationed the insulin he could no longer afford after going off his parents' insurance at age 26. His story highlighted the high cost of insulin and led to a legislative effort to create a way to provide emergency insulin for insulin dependent diabetics in a crisis. Insulin is an especially galling example of the deadly impact of the high cost of prescription drugs, but it is just one of many such examples. In spite of pharma's opposition, Senator Rosen and I started to work on the Drug Price Transparency Act as soon as the new session began in 2019 in order to bring transparency to the pricing of prescription drugs. The bill is pretty simple. It requires pharmaceutical manufacturers to report to the Commissioner of Health why they priced a new drug above a certain threshold or why it increased the price of an existing drug or a newly acquired drug by a certain percentage over a 12 or 24-month period. It must report its marketing and advertising costs, its manufacturing costs, distribution, profits, etc. There are no penalties if drug prices exceed the threshold, but it calls for a $10,000 a day penalty for noncompliance that would go into the Healthcare Access Fund. The goal is to increase transparency in drug pricing and to hold pharmaceutical companies accountable for some of their overreach on drug pricing. Similar legislation has been passed in many other states, and 40 states have introduced similar legislation, with some encouraging effect. In the states that have enacted it, drug prices are trending down. The bill passed multiple committees in the House and Senate and was included in the end of session Omnibus Health and Human Services bill. It was vigorously opposed by PhRMA, the trade group that represents the big pharmaceutical manufacturers, and possibly as a result was lost in the end of session negotiations. The funds to enact the bill, interestingly though, were set aside, but the bill language itself was not enacted. So we were worried that the opponents had successfully killed it and that money might disappear, but we vowed to take it up again during the second year of the biennium, and we got right back to work on it in early 2020. And we came at it as a united front. Often Republicans and Democrats are played off each other by lobbyists and sometimes even by their own caucuses. But Senator Rosen and I shared an outrage about the cost of prescription drugs and a desire to pass meaningful legislation to address it. We worked by bringing all the stakeholders around the table multiple times to hammer out an agreement with the understanding that we were going to get this bill done, so they'd better get on board with us. The final bill is a compromise bill, as any bipartisan bill must be, but ultimately it will provide the public and policymakers with important information about prescription drug pricing. Senator Rosen and I teamed up again on a bill to reform and streamline the prior authorization process this year. If you're a healthcare provider or you or a family member have endured the prior authorization process, you know the pain, delay, and frustration that it can create. Versions of this bill have been brought forward for the past 6 or 7 years, but for those for it and those opposed were uncompromising, so no reform has happened. Senator Rosen and I again repeatedly involved all stakeholders in the process, met multiple times with proponents and opponents, and were able to get solid reform accomplished. The new law tightens turnaround times, decreases administrative cost and burden, and improves access to patient care. I highlight these examples both because I'm proud that we were able to finish the job, but also to demonstrate that while the partisan divide is real, and it is real, if you're willing to engage, there are legislators on both sides of the aisle who are interested in making good policy. And I think that finding them and partnering with them is an important part of the governing process. Another issue that doesn't at first blush seem to relate to public health that I've become increasingly concerned about is the prospect of copper sulfide mining in water-rich northern Minnesota. Non-ferrous mining is a different and much riskier kind of mining than has ever been done in Minnesota before. International mining conglomerates who have no interest or incentive to protect Minnesota have been working for years to quietly convince Minnesotans that copper sulfide mining can be done safely without adverse environmental or economic consequences. But they are proposing doing a kind of mining that carries much higher health and environmental risks than the traditional iron ore taconite mining that we're used to in Minnesota. Copper sulfide mining produces sulfuric acid when its byproducts are exposed to air and water, which causes acid mine drainage and leaches heavy metals like arsenic, lead, and mercury into the rivers and lakes that surround the area where the mining is being proposed. This is toxic to aquatic life and poses serious human health risks. The proposed Polymet Glencore mine sits in the watershed of the St. Louis River, which drains into Lake Superior, and the Twin Metals Antofagasta mine is in the watershed of the Boundary Waters. I've proposed several pieces of legislation that aim to update our mining permitting laws to better reflect the true risks of copper sulfide mining, moving the job of mining promotion out of the Department of Natural Resources to the Department of Employment and Economic Development, with more to come. The Minnesota Medical Association and other health advocacy organizations called for a health impact study before the Polymet permits were approved, to no avail. We're on the brink of taking an enormous risk with potentially devastating consequences to the environment, human health, wildlife, and unique natural resources, as well as our economy, as the Minnesota taxpayer will be on the hook to pay for the inevitable cleanup. Copper sulfide mining has literally never been done without some kind of an accident. If you care about human health, wildlife, the Boundary Waters, or Minnesota's economy, you should care about this issue. We will all be impacted. I have learned that taking on mining in Minnesota is politically perilous, but this is a fight I'm willing to have because I believe it is my job as a state legislator to protect the people and natural resources of our state. I took a leave of absence from my practice while the legislature was in session, and the COVID pandemic contracted our practice down, like many others, for a while. But I plan to return on a part-time basis next month, and I'm excited to get back to seeing patients. I'll be juggling doctoring with a campaign that promises to be a battle. My race will be one of the most competitive in the state and will be targeted by outside groups. But I plan to run a positive, issue-based campaign, all with an eye toward continuing to work for a healthy, thriving Minnesota. It's been a true honor to represent my district in the House of Representatives, and I've loved the work. It's a responsibility that I don't take lightly, especially in these fragile times. I want to close with an appeal to all of you. If you're not already, I challenge you to get involved in the political process. We need your voices, we need your smarts, we need your engagement. Research and support candidates, work to get people elected that value and respect science. Consider running for office yourself. We're living through a perilous moment in American history. Democracy is not a foregone conclusion. It needs to be tended and constantly protected, and it requires the active engagement of its citizenry. We've never fully lived up to the promise of this great American experiment, but that doesn't mean we should stop trying. We're all in this together. Let's all be part of the ongoing and unfinished American story and continue to strive together toward a more perfect union. So with that, I'm happy to take any questions that anyone has. I've stunned you into silence.
Questions can be typed into the Q&A panel if you have anything you would like to say. Right. Kelly, we have one here.
Okay, what advice do you have about communicating science to the public? That's a great question, and it is a big challenge for all of us. Saad and I were just discussing this before the talk, and I think vaccines are a great example of that. There has to be a way of communicating about it without making people feel like they're being talked down to or patronized. And the advent of fake science, and there's all this information that exists on the internet, works against us, because as you all know, there's a lot of bad information out there. I think talking about it in simple terms, it's the balance between talking about it in simple terms without oversimplifying it. But I think we need to do everything we can to take partisanship out of it, so that it doesn't feel like it's an us versus them thing. This is about all of us. It doesn't have to do with politics. Let's see. Do you think the anticipated executive order by the president will help with drug pricing? That's a great question. And I'm not sure I know enough about exactly what his executive order said to answer it in a fulsome way. But let me go on record as saying I hope so. What is your advice for younger students who seek to impact their communities by pursuing both science and policy? That has been one of the really exciting and happy experiences I've had being involved in politics. Kids are so engaged right now. I really think that particularly around climate change and gun violence prevention, and now around racial justice, they are fired up, and they're kind of sick of the adults sitting on their hands in their view, and they're ready to lead. And that is a very hopeful development for all of us. And I would absolutely encourage kids, and that we've seen many medical students from the University of Minnesota, by virtue of proximity, I think, come to the Capitol, lobby for legislation to improve access for their patients. It's a very exciting time in that way. What can we do to better educate legislators on science? Very important question. And I do think that it is very meaningful to have physicians and scientists visit with face-to-face or Zoom to Zoom in our new world about issues, explain why they're important to you and why they're important to the public. So the personal touch, particularly if you live in someone's district, is very meaningful. And I think that the more that we in the medical and scientific and engineering worlds can do that, the better. Let's see. Vaccines for COVID-19 appear on the horizon, but there are concerns about acceptance of new vaccines needed to establish herd immunity. What can you and the state legislature do to help Minnesotans take advantage of new vaccines? Great question that I started to touch on before. I think that it's going to be very important on both a federal and state level that we do all we can to make access easy and very cheap, if not free, so that we can approach herd immunity. And it's going to have to be accompanied by public health messaging around the safety and around why it's important. I think that's going to be enormously important. I'm reading Dr. Kandarian's here. This conference is focused on gene editing and gene therapy. We're witnessing new therapies in this area that are costing hundreds of thousands, or in some cases over $1 million. What are your thoughts and strategies to deal with such expensive but potentially curative therapies? That's a very challenging question. And that's been one of the criticisms of the Drug Price Transparency Act, that it will somehow stifle innovation. And I really don't think that that is the case. And I think that that same logic applies here. And there's obviously overlap between the two. I do think we're going to need public investment to bolster some of that. And a lot of this work will involve ethical considerations and a lot of public explanation too. So keep doing the amazing work you're doing, and keep talking to policymakers would be my message on that. The CDC seems to be under attack by the administration. Are there things we can do to help maintain its integrity and availability to its information? That is one of the many disappointing things that is happening right now. I'm hoping, it seems like the president may be sort of coming around to the reality of what we're facing. But the recent move to bypass the CDC with COVID statistics is a very troubling moment. And I'm hoping that that will change either by changing who's in charge in November or by individual states not refusing to comply with that. Any idea on how to respond to the idea in the public that all scientific opinions are equal? Recognizing sources of information that are more informed than others. This is again one of our big challenges with the mixed blessing that is the internet, with the unedited information. I think that as we look at social media sites like Facebook and Twitter beginning hopefully to be held more accountable for the content that they allow to be promulgated, that there may be a way for us to, without censoring or editing people, having some kind of a signifier on public information that's on the internet as to whether or not this, some kind of ranking system in terms of the validity of the evidence, and then something like a black X on it if it's outright untrue. But this is a huge challenge in many areas, and particularly in in the medical and scientific arena. Great questions. Thank you.
Okay, here we go. One more.
Do you have any planned initiatives or programs for recruiting STEM professionals to engage more in policymaking? That's a great question. That's a good one to end on because that will send me on my way with a task. I do not have legislation currently planned. I know the University of Minnesota, and I'm sure the Mayo Clinic is encouraging that, but that is sort of a call to action for me. So I appreciate the question.
Okay. Thank you very much, Kelly, for your presentation.
Well, thank you so much for having me. It's a pleasure.
We will have people joining for session 8 starting at 1:30. And I'm putting that link into the chat panel. That is the regulatory session, genome engineering and the regulatory landscape. So we will see you there at 1:30 and have a great lunch hour.